think we'll get started since the new participants coming into the room have sort of leveled off. If other people come, they're welcome to join. Good afternoon, everyone. I'm Kim Kazar from Lurie Children's, and welcome to TEN-4 Day 2025 info session. Today, Mara, next slide, please. Today, first, I should say that I represent Lurie Children's. I am a co-developer of the TEN-4 Faces P app and a co-developer of the LCAST app. I'm joined today by Dr. Mary Clyde Pierce, who is the lead developer of TEN-4 Faces P and a co-developer of the LCAST app, as well as Mara Powell, Shannon Moody, and Debbie Abreu from Kentucky Youth Advocates. Together, the three of them co-led the first TEN-4 Day nationally in 2019 and have been leading this nationwide effort since then. And also on the call from Mass General Hospital and Harvard Medical School is Drs. Lee Chua and Bishoy Ibrahim. And they have been leading the advocacy aspect of TEN-4 Day. And so I'd ask everybody to just reintroduce themselves when they join to speak. Mara, next slide, please. So once again, welcome everyone. Thank you for taking time out of your day today to be part of this TEN-4 info session. Dr. Pierce will lead us off with an introduction to the TEN-4 Faces P bruising clinical decision rule. We'll talk a little bit about the catalyst for having a TEN-4 day and its evolution, and then offer some tips to organize a TEN-4 day in your state or local area. And we'll conclude with some state highlights, specifically from Michigan, and a little bit of Q&A. And we have purposely reserved time at the end for group discussion. So with that, I'll pass this over to Dr. Mary Clyde Pierce to introduce the TEN-4 Faces P bruising clinical decision rule.
So hi, everybody. I'm Mary Clyde Pierce. I'm here at Lurie Children's Hospital in Chicago. I'm a pediatric emergency medicine physician, but also have a background in child abuse pediatrics. And my mission and passion has really been in helping develop evidence-based tools and rules that help us do a better job of identifying and differentiating abuse from accidental trauma. So that lands me on why am I so focused on bruises? Well, it turns out bruises are actually more common than any other injury from abuse or accidental trauma. And they're also the most common injury that occurs before a fatal or near fatal event. In fact, anywhere from 30 to 60% of children will have bruises that are present prior to a fatal or near fatal event. So this is really critical, that sentinel injury or those prior injuries that help us know that there's bad things that are about to come. And if we can recognize these much earlier, it can make a big difference. Next slide. So if we first published this in 2010, when Kim and I were actually in Louisville at what was Kosare Children's Hospital at that time, we published our TEN-4 rule. That was based on basically 100 patients in the intensive care unit in Louisville. And obviously the results were exciting, but with just 100 patients, we needed to move on and to validate that and to have a better understanding of differences in abuse and accident. You can do the next slide. So that it actually allowed us to actually get an NIH grant to validate this rule. So we had many hospitals involved, and we literally did screening exams on over 20,000 children. And we were able to then validate not only the TEN-4 rule, which I'll tell you what those stand for in just a second, but the FACES piece as well. So we were able to add additional areas that help differentiate abuse from accidental injury, because clearly being physically assaulted injures you very differently than having an accidental event. And so it's just based on that principle alone that we pulled this data together, working with biostatisticians and many other people that helped us advance this work. So towards TEN-4 Faces P, atypical and unexplained bruises. Clearly remember that this is actually a screening tool, not a diagnostic tool, but it's atypical and unexplained bruising. TEN stands for torso, which is your chest, abdomen, back, buttocks, and GU. Ear is your ear, and the neck, so that's what TEN stands for. 4 stands for any bruising anywhere on an infants that are 4 months of age and younger. And then faces, all of these areas are on the face, which we were excited about. But the frenulum, you have 3 of them in your mouth. The angle of the jaw here, your fleshy cheek, the eyelids, literally your eyelids, not the orbital rim, but your eyelids, and then the subconjunctiva. and then patterns. So that's what the P stands for. Next slide. If we have this, if there's a little QR code, you can actually go on even a website there, and all of these are free for you to use, just like you can download them, print them out. We wanted to kind of standardize what was going on, but it's a nice infographic that helps you remember the TEN-4 faces P. And then we publish this, and it's a free publication. It's it's an open network publication, JAMA Open Network. So that means anybody can access it, which we're really excited about. But sometimes visual is really I'm a very visual person. And so you can see here how different abusive bruising was from accidental bruising. Made us call it non-abuse, but accidental bruises versus abuse bruising, how different that is. And look how many more injuries those abused children have as well. That's just important. That's in the supplement of the publication. Can go to the next slide. Again, in the publication, just showing how different abused children are from the accidentally injured children. And those regions is when we actually looked at the data, we didn't know what the results were going to be. So we looked at every single region. I think it was 36 different regions of the body in all these children. And that's what actually drove the model. We didn't have any idea what we were going to find. And it ended up being quite powerful. Next slide. Like, for example, see the angle of the jaw up there on the infants, especially you can see along the angle of that jaw. This is something we discovered by just even doing the composite of all the findings and all the results. And so the results are what drove the model. And then we have here, because all of the regions we looked at, so you can actually see for yourself what the likelihood ratios are of each area. You can see how wildly different it is, angle of jaw bruising or subconjunctival hemorrhages. If you want data, it's right there for you because I'm a very data-driven person as well. And so that's can help hopefully inform your decision making, because obviously this is just to augment your decision making, not to supplant it. Obviously, that's a lot of complicated information, and you can't always just go to an article. So we actually were able to get a grant and actually build an app. It's called LCAS, which is Lurie Children's Injury Plausibility Assessment Support Tool. It'll be expanding in the future to other injuries, but right now it has embedded in it bruising, and it has also Ken Emel's brain injury rule in it as well. So you're able to click on areas, see what you're finding on your patient. You can go directly to the predictive regions, or you can actually ask questions that'll lead you to some critical questions. It also has embedded in it references, PubMed links to all kinds of injuries. It has gives you what American Academy of Pediatric recommendations workups are. So it has a ton of information in it. And again, this is just the 1.0, and we hope to have 2.0 in the future because we want to keep advancing it, improving it. But it's free download, that most importantly for both Android and Apple, free download. Thank you. I think Shannon, you're going to take it away now, right?
I am. Thank you, Dr. Pierce, and really grateful for the work that Kim and Dr. Pierce and many of the researchers have put into this and helping to build awareness and really continue to develop out the research around this so we have a better understanding of what to look out for as practitioners or folks who are in contact with children. So I'm Shannon Moody with Kentucky Youth Advocates, and TEN-4 Day actually began in Kentucky. And I think I've often heard that nothing ever starts in Kentucky, but I would argue that we have some innovation here that's happening, and we're really proud to be the home site for the very first TEN-4 Day. So the way that the TEN-4 Day started in Kentucky is in 2019, as a social worker, I went through my required training around pediatric abusive head trauma. In Kentucky, there are many professionals who are required to take pediatric abusive head trauma continuing education for their licensure, including nurses, social workers, doctors, radiologists, other folks who would benefit from having information about it. And within that pediatric abusive head trauma, we obviously have the TEN-4 faces P bruising rule as a key component in that teaching. And I was having a conversation after the training with the physician who is providing it, Dr. Jenny Green, who's now at University of Kentucky. And she said, we really need to figure out other ways to really expose individuals to this rule because it's easy to remember, it's easy to understand, and it feels really accessible. So from there, we took that notion of the need for education and awareness and applied it to what we know with the Face It movement about how to get word out in ways that are kind of sticky and help to build momentum. So in 2019, on October 4th, we launched the TEN-4 Day in Kentucky, and we did that in collaboration with the University of Louisville, Dr. Melissa Curry in particular, and then the University of Kentucky with Dr. Christina Howard, and hosted 2 events that included a kind of a press conference opportunity. We invited media, and then also had them provide a training so that the learning was there and the education and awareness building was kind of baked in. And we also that year, for the first time, had the governor of Kentucky proclaim it to be TEN-4 Day. From there, what we started to identify is that we picked up some momentum. We got a lot of people who were interested in joining the trainings, and then partner organizations who serve kids and families in some way wanted to help pour into the efforts and really build out opportunities for additional ways to get involved. So over the last couple of years, we have provided more training opportunities, both virtual and in person, with our credentialed, qualified professionals who can provide that pediatric abusive head trauma training. They also include the TEN-4 bruising rule and safe sleep within that education. And we build that out for anyone, not just people who serve kids and families or need the CEUs. We open that up to the public. Beyond that, we've also created opportunities for local proclamations. So the county judge executive in Grayson County, or the mayor of Lexington, or the mayor of a small rural town in Kentucky, they are proclaiming it TEN-4 Day on October 4th to help generate a conversation and really help our providers who are in that area to understand what the opportunities are to, one, know what that rule is, and also learn about ways to prevent child maltreatment from ever happening. Beyond that, we have created ways for people to customize what their TEN-4 Day looks like based on, having templates for proclamations, having different opportunities for trainings, having positive parenting events. We've started pairing TEN-4 Day and recognizing and reporting and learning that bruising rule, along with opportunities for parents of young children to connect, socialize, and get access to resources in order to kind of complement the educational opportunities and conversation and really drive home the options for prevention. And we've also developed things like an oral health provider toolkit to make sure that folks who are not necessarily thinking about the TEN-4 bruising rule as they are looking in a kid's mouth, maybe that is more top of mind if they've been able to see that toolkit and have an opportunity to learn more about it. So we have seen it grow every year over the last couple of years. We're really excited to have folks on today to talk about the potential of what you all would like to do within your state to raise awareness about this really important bruising rule, and also generate ideas on what it could look like for your state, because the options and opportunities are kind of limitless based on what you'd like to do, what kind of audience you have available. And also you'll hear from some other states on what they've done as well to really make it their own and identify opportunities for those TEN-4 Day or week. We've kind of turned it into a week opportunities within October and around October 4th. So I'm going to pass it over to Dr. Chua, who will talk to you all about how we have shared resources and really created more advocacy opportunities for our networks.
Perfect. Thanks, Shannon. As you guys can see from the work that Shannon and the crew in Kentucky have done, it's really a multidisciplinary effort to be successful. And we've been able to collaborate across different professions, from social work to physicians to nurses. EMS has become a really great partner to kind of spread the word, because so much of the work that they do deals with kids with injuries. Part of the really exciting collaboration is working with government leaders. So in Illinois and in Massachusetts, where I've practiced clinically, I've had a great opportunity to work with the Department of Governmental Affairs, as well as the media relations teams of both hospitals. And they've really taken leadership in helping us kind of expand the work from outside of the hospital into the community, and then leveraging the media and social media to really kind of get the word out. So it's been a really exciting opportunity for me as a pediatric emergency medicine provider to really learn how to do this work that's beyond sort of what I was taught in medical school. So yeah, really excited to be a part of this team and to watch this coalition really grow. I want to pass it off to Dr. Ibrahim, who is one of the residents at Mass General Hospital where I work, to talk a little bit more about the work we're doing and to introduce a guest. Bishoy, I hand it off to you.
Thank you, Dr. Chua. My name is Bishoy. I'm a pediatric resident at Mass General Hospital. I've been with the 10-4 Day Advocacy team for about a year now. I'd like to introduce Ryan Spiedel. He'll be sharing with us his team's approach to 10-4 Day. Ryan Spiedel has over 2 decades of public service experience in law enforcement, regulation, and leadership. He has conducted various investigations for the city of Jackson in Michigan, the Michigan Department of State, Office of Inspector General, Michigan Commission on Law Enforcement Standards, and the Office of Children's Ombudsman. Ryan earned a bachelor's degree in sociology with a minor in criminology and criminal justice from Eastern Michigan University. He graduated from the 72nd Mid-Michigan Police Academy. Governor Gretchen Whitmer appointed him as Michigan Children's Ombudsman on May 30th of 2023. And in December of 2023, the office name changed to Office of the Child Advocate, with Ryan continuing as Michigan's Child Advocate. I'm going to hand it over now to Ryan.
Thank you, Dr. Ibrahim. And hello, everyone. It's good to be here with you this afternoon. As Dr. Ibrahim said, my name is Ryan Spiedel. I am currently Michigan's Child Advocate, and I want to give you a little bit of a background of what my office does to give some context to how we fit into this discussion. My office is required to review cases of child protective services, foster care, and adoption that lead up prior to the death of a child. So if the Department of Health and Human Services in Michigan has had interaction with a family due to protective services, foster care, and adoption in a certain amount of time prior to a child dying, we take a look at those cases and review those cases to make systemic improvements and make recommendations. And this was in early 2022. We were conducting an investigation. The child who died, her name is Trinity Chandler. And I was hoping I could share some pictures of Trinity, but we were at Kids Talk. It is the Child Advocacy Center of Wayne County, which is our largest county by far. It's where Detroit, Michigan is located. And we were discussing some things with the medical director, Dr. Dina Nazer. And she brought up to us, have you ever heard of TEN-4 Faces P? Now, as you've heard, I've been in investigations for over 22 years, 10 of which was spent as a police officer and detective, and 5 years in this role, and I had never heard of TEN-4 Faces P. And as Dr. Nazer started to discuss TEN-4 Faces P, and we looked at the pictures of Trinity, it was very clear and evident that she had child abuse injuries prior to her death. Now, the protective services investigator and the trooper that investigated those child abuse allegations were not really at fault. They did not know what they were looking at. They did not have the tools in their toolbox to understand the injuries that they were looking at. So all they had to go with was what mom was telling them, which was a fabrication. But instantly I recognized the importance of TEN-4 Faces P, how simple that rule is for individuals like myself that don't have a medical training, and how we can use the terminology to have open discussions and dialogues with our child abuse experts in the medical field. So we have a common language to discuss. And here in Michigan, we believe the same thing. How do we get this word out to as many people as possible? So in 2023, we did submit an application for proclamation to the governor here in Michigan She did proclaim October 4th, 2023 as TEN-4 days, TEN-4 day. However, we missed it in 2024. We were a little bit busy. We were busy producing a video, a training video. It's about a 5.5-minute long video, and it has professionals from around the state that are well regarded, from the University of Michigan, from police agencies, from EMS, paramedics, as well as the Department of Health and Human Services and my office. And what we do is we discuss TEN-4 Faces P, we define it, we provide a description of what it is and photographs, as well as how to interact with individuals in each profession. So we as investigators can recognize these injuries as potential for child abuse. I can tell you on a personal level that leaving the police academy over 20 years ago, I had 80 hours of domestic violence training. And I could tell you the difference between an offensive wound and a defensive wound. I had a little over 3 hours of training in both child abuse and elder abuse. Those two are squashed into the same 3 hours, and I could not tell you. I had to learn through experience what child abuse injuries looked like. That's not acceptable. So with this video, we garnered a lot of emails, about 600,000 emails from licensing and regulatory affairs, from the Department of Health and Human Services, state police, the Michigan Association of Chiefs of Police, the Sheriff's Association, and we got all these partners together, and we were able to send our training video out multiple times and track some of that information, who was opening the emails, and clicking on the resource link, who was opening the emails, clicking on the video, and actually watching the videos. What we wanted was a video that a trooper could watch in his car on his cell phone, or a medical practitioner could watch on their laptop while they're sitting in the break room on their 5 minutes of peace. So this is something that we plan to push out again come this October. We would like to apply for another proclamation this year, potentially do a press release to get the media involved. I would like to get our video out to as many mandated reporters as possible, because often we find two things in this state. We find what Dr. Mary Clyde Pierce said was physical child abuse is being missed just before a child's death. Simply, we don't know what we're looking at. And then secondly, our mandated reporters tell us often, we know how to report, we know where to report, we just don't know when to report. And maybe if we can give them a little bit of tools and things that they can talk about when they call in, we can have a little bit more success in preventing child death here in Michigan.
Thanks so much, Ryan. Really appreciate the leadership that you've taken and the incredible work that you've done as the child advocate in Michigan. It's amazing how much range that you've been able to kind of get this message through. So yeah, we really appreciate you taking the time to join us. I think we'd like to transition now to open it up to the participants. Try to figure out what opportunities you guys are interested in, and how we can continue to collaborate and kind of build this coalition. So I kind of open it up to the team. Feel free to raise your hand and or just speak up. And yeah, we look forward to the fruitful conversation. Thanks again, Ryan. Really appreciate you.
You're welcome. Thank you.
And Ryan, in terms of the video, is it something that would be able to be shared across state lines, or is it something more specific to the work being done in Michigan?
No, it's absolutely something that can be shared across state lines. In fact, before we started, we reached out to Lurie Children's Hospital and Dr. Mary Clyde Pierce because we wanted to get permission to use the same exact documents that are used on their website. So it is the same information. The video can be sent out to this group. I would like to share it as far and wide as possible. I think at first we were concerned with over-reporting of child abuse, but I don't know that that's too much of a concern. But yes, I can definitely share it with the individuals in this group, and you can share it with whom you deem necessary.
And I've seen the video as well, and I have to say I really really was impressed with it. It wasn't cheesy or anything like that, you know. I was really, really impressed with it. And I think you do a nice job, or your team did a nice job of like saying this is just a screening tool. And that it's still they're the decision maker, but it really raises awareness of like these kind of really unusual, atypical bruises that really are heralders of bad things to come if we don't act, you know.
Hey Ryan, did you offer any continuing education for law enforcement with the training? Have
No,
you
but
explored that route? And
no, we did not. So in Michigan, there's no requirement for continued education, unfortunately, for police officers. However, we did get there's a organization called the Commission on Law Enforcement Standards. They're responsible for developing curriculum for the Basic Training Academy, and they just made it mandatory to air this video in all of their training academies. So that's a win for us because, like I said, I distinctly remember the first child abuse call I went to as a young rookie police officer, not knowing what I was looking at in a very young infant that had bruising on her face. And I could not articulate the things that I was seeing, and how to talk and interact with the physician. So this is something that we believed you can give that common language to law enforcement and arm them with that information. And that's why we pushed with the Commission on Law Enforcement Standards to make it a standard video in their basic training academy.
okay, thank you. Kentucky split up a little differently, and we have to go through Justice Cabinet, or we go through the state police or Jefferson County to for their trainings. So there is continuing education, which might it's not a standard component of their training. Be an awesome way to expand it.
I have a question. Will there be another template for the proclamation that comes out this year? Great.
Yeah, we can definitely circulate that, and we can, Mara will touch on that later as far as like communications. But we'll have those resources circulating, and we can send it to you as a follow-up, Ryan, if you'd like.
Great, thank you.
Are there any other questions? I think Ryan and his team have done an amazing job, and it's a little bit intimidating to think that you have to take on a statewide effort like they have. But 10-4 Faces P or 10-4 Day starts with a simple act that is relevant to your local context. So it can start with one talk or one engagement and then grow. So I don't want you to feel intimidated by the phenomenal work that Ryan and his team have done, but we definitely want to highlight their success because we have just been so impressed with the work that they've done there. And I think it shows something to really aspire to for all the states.
Mm-hmm. That the video's already made, I mean, that's already can get a foot in the door. I mean, there's so many things. That's what's nice about this team, that you know, just trying to, you don't have to start from scratch each time. There's so many things that have actually already happened that you can actually just tag on to, you know.
Hey Shannon, do you all have like a social media campaign kit if we wanted to have something like that to download with hashtags for Facebook, Twitter, anything like that we can use during the month or leading up to it?
We do in Kentucky. We've got the faceatabuse.org. We've got the toolkit on our website, and then I know that Lurie has the infographic and some videos on their website, and we'll have we can send that as a follow-up as well, the current resources that are already out there. Ryan, if you're okay, we can send a link to your video too.
Absolutely.
Awesome.
Jessica, if you're available to share your experience with getting a proclamation, we'd love to hear about how that went.
Sure. Are you guys able to hear me?
Yes.
Yep, loud and clear.
Sometimes my technology does not work very well when I'm like trying to connect multiple things. So yes, the process for us giving our governor's proclamation was simple. We followed the outline that was provided by you all. It probably took me maybe 25 to 30 minutes to submit that and received it rather quickly within about 4 weeks. So I just submitted it about 4 weeks ahead of time of 10-4 day, and we were granted that.
Thanks, Jessica. Yeah, one of the things as I've looked through the different state proclamation submissions, I've seen it range from as short as 2 weeks to as long as like 6 weeks. So definitely something if you're interested in pursuing, we can definitely help you guys through that process. But just be mindful that different states have different deadlines on when to get this submission in.
Yeah, depends on what else is going on and when your sessions are and all kinds of things, you know.
And the proclamations are a tool, oftentimes to generate media opportunities. And like we had given examples of earlier, you can do that on a local level as well. If sometimes, like if the governor's office is just not as accessible, a city or county proclamation or district proclamation are also available. Or if you just want to partner with the or you are a potential trainer partner to host your own event and share that out. That's also another optimal way to just draw interest and engagement from folks. Ryan, go ahead.
I did just drop the link in the chat, and I do believe that once you open the link in a web browser, there is an option to download the video. And I don't want to intimidate anybody either. This was a project that we had extra money in a budget in 2024. We did not do this ourselves. We were able to hire a marketing firm to do the work for us. So you can see it's a very professionally done video. We wanted it to be that way, and we had the resources to do it, fortunately, in 2024.
Hey, Ryan, quickly, do you have an estimated budget of how much it costs you to,
So for
if we were
us,
planning?
yeah, so for us here in Michigan, we obviously everybody volunteered their time. We didn't pay actors or talent. This project ran just shy of $100,000 to produce the video.
The questions. So one of the things that we're trying to do with this ad hoc coalition is to have a level of resource sharing to make sure that people are not recreating the wheel and that we can share resources. And the Face It movement has really taken the lead on synthesizing the information we have so far. And I think, Mara, you're going to say some things about where that information is housed.
Yes, I'm happy to jump in if there's no more questions or sharing of what your states have been up to in this space. But yeah, I'm Mara Powell with Kentucky Youth Advocates and help coordinate with Shannon and Debbie on the Face It movement and have been with it since the beginning for 10-4 day. And I'll go ahead and throw this slide back up as well because we have there we go. We have where we're starting a listserv, and I don't want it to sound like, oh gosh, another listserv with lots of emails. But we are thinking, you know, some regular updates from this kind of core team to be able to share out some, you know, like the resources that Michigan offers, like the templates and all of that we generate here in Kentucky to support you all. And so, yeah, we encourage you to sign up on here. I also can drop the link in the chat, or Shannon, if you can do that, it's linked in the agenda. But yeah, we encourage you all to join that. And that's just a way to stay up to date on kind of those, you know, reminders like, hey, we're about 8 weeks out, maybe get the your proclamation, you know, template going, like those kinds of reminders leading up to the big day. And so, yes, I think as we've heard throughout the presentation, there's a bunch of different ways to get involved. And it starts with, those small wins that can build momentum in your community or in your state. With proclamations with the governor or mayor's offices, or county judge executives, raising awareness just within your hospital, or with your state, other state leaders like legislators, or our attorney general's office has been really engaged within this space as well. Social media day of and throughout, leading up to it to really gin up awareness of, TEN-4 day and using that hashtag or, whatever you put together to just kind of have a big social media splash. Press release day of, I think, is always a great way to generate that as well. I think scheduling a training, we've heard that's how, here in Kentucky, we were able to do those initial trainings to kind of get folks to, join, to understand what we're talking about, and to offer that as a resource, in addition to raising awareness about the rule and the day. Or you can go big like Michigan and create a new training video, or something that is works in your state that's for all the mandated reporters of abuse, and to make sure that they have the tools that they need to recognize abuse and know how to report, when to report, what needs to go into that report, and all of that. So we encourage you all to sign up, and we will be sending out a follow-up email with all of this information and more. And so we encourage you all to share with any colleagues who maybe weren't able to join today. We'll have this recording too, so you can share that out with them, as well as any of the resources and that link to the email listserv, because we want to be, we want to keep bringing people in. We were so pleased to see how many different states were included in our registration for this today. I know not everyone can join live, but that's why we record these things. So really appreciate you all joining us today. And yeah, if there's not any follow-up questions or, am I seeing a couple things dropping in here?
Yeah, I think there's some things in the chat.
Okay, sure. We can go back to that. Oh, does it look different for special needs children? Dr. Pierce, do you want to take that?
We would think that it would. We didn't study special needs children with this TEN-4 rule, but I think it would be, I don't know if anyone has or not. Kim, are you aware if anybody has studied that? Because I think it's would be a really meritorious study to do to see how well the rule performs with children with special needs. Especially because sometimes they have cerebral palsy or other things that make them more likely to fall in certain ways that aren't as predictable as with children that can protect themselves with their own reflexes or whatever. It's a really good question, and it wasn't designed for that population, but I think it would be very valuable to look at that,
I would definitely be interested in any information y'all have on any studies done specifically for children with special needs. Where I am located, there tends to be this attitude of kids with special needs, if they get bruises while being disciplined, it's okay because they have big behaviors. And I obviously am in disagreement. And would like to bring more information, but I need that information to specialize in children with special needs so that we can educate people.
Yeah. Is Kathy Makaroff on this? I thought I might have seen her at one point. She's really
Just stepped away.
She did step away, yeah. I think that there's a lot of, there's it's a really good question. And I think that there's a way to help advance evidence. And I love these kind of meetings because you always see what people need. And so the evidence is there for us to design and to answer questions, so we, even if we collect new evidence, because it's just all about answering questions that we need answered so we can now advocate and do a better job,
Absolutely.
I can't tell you how many times I get notified, either phone calls, text, or emails from people from all over the world that actually tell me that by using this simple rule, they've been able to diagnose abuse that they would have missed. And some people say that they've been able to help, realize something was accident, but it's actually been really a little bit surprising and rewarding to how many people actually really have found benefit from something simple. And I think its simplicity is what really makes it more usable, you know.
Well, thank you for your questions. If there aren't any additional, we can wrap up a little bit early. But yeah, look for a follow-up email from us and join that listserv so we can stay connected with you to be able to resource share as we can leading up to October 4th, 2026, which is on a Saturday this year, which makes it a little bit interesting. But we will work that out marketing wise.
Well, the Kentucky Derby's on a Saturday, so we can make this work, you know, so.
True.
Okay.
All right.
All right, thank you.
All.